Hello everyone, and welcome to our virtual training program. In this module, we will be discussing traumatic brain injuries. A traumatic brain injury, or TBI, is an injury that affects how the brain works. It happens when a sudden, external, physical assault damages the brain. There are many causes of head injury, and among the most common are motor vehicle accidents, violence, or falls. TBI is a major cause of death and disability in the United States. In 2021, 190 Americans died from TBI-related injury each day. More than 223,000 individuals were hospitalized in 2019 due to TBI-related issues. And of these individuals, 80,000 are discharged from the hospital with some TBI-related disability. But before we continue with our presentation, why is this information important for caregivers? Research suggests that providing caregivers with sufficient information about the care recipient's illness and care needs is important to enhance their knowledge about the consequences of the injury. It also allows them to reach a greater understanding of the injured individual's situation and needs. As such, providing caregivers with the opportunity to learn about traumatic brain injuries can contribute to greater self-efficacy, confidence, and well-being of caregivers. It is important to note that, as no two people are exactly alike, no two brain injuries will be identical either. This means that your loved one's experience is unique, and they may not necessarily have the same secondary effects as someone else with a brain injury. However, this presentation is a general overview of brain injuries and common associated consequences. Okay. Now let's get back to the presentation. TBI is a broad term that describes a vast array of injuries that happen to the brain. There are three principal ways to classify TBI. First, the damage can be focal, confined to one area of the brain, or diffuse, which means that it happens in more than one area of the brain. Additionally, traumatic brain injuries can be classified based on the severity of the injury, which can range from mild TBI and concussions to a severe injury that results in coma or death. Most TBI that occur each year are mild TBI or concussions. A mild TBI or concussion is caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the brain to move quickly back and forth. Moderate and severe traumatic brain injuries are often caused by falls, firearm-related injuries, and motor vehicle crashes and assaults. And lastly, brain injuries can be classified into primary and secondary. Primary brain injury refers to the sudden injury to the brain, which happens at the time of the car accident, gunshot wound, or fall. Secondary brain injury refers to the changes that evolve over a period of hours to days after the primary brain injury. It includes an entire series of stages of cellular, chemical, tissue, or blood vessel changes in the brain, which may contribute to further destruction of brain tissue. What are the different types of TBI? Brain injury may happen in one of two ways. Closed brain injury happens when there is a non-penetrating injury to the brain with no break in the skull. This is caused by a rapid forward or backward movement and shaking of the brain inside the skull. It results in bruising or tearing of the brain tissue and blood vessels. Closed brain injuries are usually caused by car accidents, falls, and sports. Penetrating brain injury happens when there is a break in the skull, such as when a bullet pierces the brain. This type of brain injury constitutes the most severe of traumatic brain injuries, and it is the most likely to result in death. So, what are the possible results of brain injury? Some brain injuries are mild, with symptoms appearing over time with proper attention. Others are more severe, and may result in permanent disability. In the following slides, we will be discussing different categories of deficits that people with traumatic brain injury may experience. Cognitive deficits, including confusion, shortened attention span, memory problems and amnesia, problem-solving deficits, problems with judgment, inability to understand abstract concepts, loss of sense of time and space, decreased awareness of self or others, and inability to accept more than one or two-step commands at a time. Motor deficits include paralysis or weakness, spasticity, poor balance, decreased endurance, inability to plan motor movements, delays in getting started, tremors, swallowing problems, and poor coordination. Some individuals may also experience perceptual or sensory deficits, such as challenges in hearing, vision, taste, smell, or touch, loss of sensation of body parts, left or right-sided neglect, difficulty understanding where limbs are in relation to the body, and vision problems including double vision, lack of visual acuity, or limited range of vision. Depending on the location of the injury, people may also experience communication and language deficits. These include aphasia, which is difficulty speaking, understanding speech, or choosing the right words to say; alexia, which is difficulty reading; agraphia, difficulty writing; apraxia, which is difficulty knowing how to perform very common actions, like brushing your teeth or putting pants on; and agnosia, which is problems identifying objects and their function. Functional deficits include impaired ability with activities of daily living, problems with organization, and inability to drive a car. Some individuals may experience social difficulties, such as impaired social capacity, difficulty making and maintaining friendships, and difficulty understanding and responding to the nuances of social interactions. And lastly, individuals may experience personality or psychiatric changes, such as apathy, decreased motivation and increased fatigue, emotional lability, irritability, anxiety or depression, and disinhibition, including aggression, lowered frustration tolerance, and inappropriate behavior. But can the brain heal after being injured? Most studies suggest that once brain cells are damaged, they do not heal or regenerate. However, recovery after brain injury is possible, as other areas of the brain start to make up for the injured tissue. The brain can learn how to reroute information and function around the damaged areas. The exact amount of recovery is not predictable and may be unknown for a long time, as each brain injury and rate of recovery is unique to the individual and situation. For more information about neuroplasticity, which is the ability of the brain to form and reorganize synaptic connections, please view our video on the topic. And lastly, here are some general helpful tips for caring for someone with a traumatic brain injury. First, let's talk about what you should do. Give them independence. Although it may be tempting for caregivers to help brain injury survivors in everything, this can slow down or harm their recovery. Engaging in everyday activities like dressing, bathing, and cooking independently, or with assistance for safety, is part of therapeutic rehabilitation too. Encourage rehabilitation exercise. With enough practice, your loved one can learn to initiate activities again. But until then, they will require your assistance and motivation. Be patient with emotional difficulties. As we know that brain injuries can cause emotional and behavioral issues, it is important to be understanding and remain patient when possible. Work on communication barriers. Previously, we discussed the communication disorders that some individuals may experience after a brain injury, such as aphasia. Please note that these difficulties do not mean that your loved one has lost their intelligence. It simply means that they lost their ability to produce or understand language. Search for ways to best communicate with each other. For more information on aphasia, please view our module on this topic. Now, let's talk about what you should not do. First, do not isolate yourself or lose your important relationships. Maintaining social support is an essential part of caregiving, for yourself and for your loved one. Do not ignore the invisible side of brain injuries. These include symptoms that are not easily detected, like fatigue, depression, anxiety, and cognitive deficits that manifest in subtle ways. And lastly, do not ignore your own needs. In order to best fulfill your role and responsibilities as a caregiver, your needs must be met. Take time for yourself and continue engaging in the activities that are meaningful to you. For more information on occupational balance, please visit our module on this topic. Thank you for your attention during this presentation. We hope the information was helpful to you.